So now we are going to see the care plan format for the history collection for the psychiatric patients. History taking format in psychotic nursing. 1, 2, 3, 4, 5, 6, 7. These 7 things we have to collect from the patient. If the patient is not able to give a proper information or correct information as they are mentally ill, you can get the information from their relatives or who is accompanied with him. Our point is, important thing is, we have to collect maximum informations that will help us to provide a good treatment. You see here, first one is identification data. Identification data, it deals with their age, name, sex, education, that type of things. It will comes under identification data. Presenting chief complaints, the main complaints which are present to the patient now or past few uh, years or months. The main complaints we have to get separately. History of present illness. What are the problems now we can see to the patient that we have to collect. Treatment history. What are the treatments he is getting now? That also we have to write. And past psychiatric and medical history. Same. It means before get the current problem. If he was getting any treatment or any illness, maybe that may be psychiatric illness or medical history, medical illness, whatever, that we have to collect and record it here. Next is family history. From their family history we have to take. That will helpful to understand his problem or the causes of his problem, and it will help to solve the problems. So we have family history we have to collect. And personal history, his personal history. It means in childhood history, if he is as an adolescent or well when his birth, any problem was there or not. So these type of things will comes under his personal habits. Everything will comes under personal history. So now detailing we are going to see. First one is identification data. You see that's name, age, sex, father's or spouse name, father or spouse name. Okay, then address, education, occupation, income, marital status, religion, informant. This is special here in psychiatric care plan. It is a special informant. Who is informing? Because most of the time the patients are not able to give you a proper information. Already I said because they were mentally ill. So that's why who is giving? We have to collect from their relatives also, or who is accompanied with them during the hospital visit or during the hospital stay. So their relation or their name we have to write here, informant. Maybe father or spouse, children, friend, or whatever it is, we have to mention here. Then information, then after from the informant we are getting information, so that is relevant or not relevant to the patient's condition, that we have to, that also we have to mention. Because if the friends are taking to the hospital, sometimes they may not know the patient's past experiences. So maybe the current situation, they know, they only give current informations. So that's why that time it is irrelevant or not relevant. The information is not relevant. So relevant is exactly why this problem happened, from where it is started, what are the signs and symptoms exhibited by the patient. Everything we can get from the uh, accompanied persons. So that is called, that's what we are mentioning here. The information is relevant or not relevant. Okay, then adequate or not adequate. Is it adequate or not adequate? How much information you are getting? If it is adequate, means that is the informations are very helpful to start the treatment. Then it is adequate. The informations are not adequate to decide what actually happened to the patient. then that condition is called not adequate information. So these are the things we have to collect in identification data. This will make the make the nurses or doctors to identify who he is, what he did, or how much knowledge he is having. In education, through education, we can understand their knowledge levels. If he is highly educated, then based on that, our upcoming treatment will be there. Or, for example, if in mental status examination, some general knowledge questions we need to ask to understand their cognitive function. For that time, if it is educated, some educated type of questions we can ask. If it is uneducated, illiterate, then related to that questions, what the general people what they know, based on that questions we have to ask. So for deciding that things, this education, so like that occupation, then these things will be very helpful that time. Then is economic status, because these mental problems mostly available uh, in the poor economic status families. So income, through income we can understand their economic status, and it is helpful to find the causes of the problem. It also helpful, not only this, it also helpful. Then marital status, from the marital status we can understand the cooperation between the family members. A religion, based on the religion we can understand this culture, because different religions follow different type of cultures. One religion uh, and since some behavior is not acceptable in one behavior in one religion, but it is acceptable in another religion. So to understand that, this identification data, religion identification data, will help to the nurse and doctors, psychiatric nurse and psychiatric doctors. So like that, this identification data is very helpful. Okay, next, presenting chief complaints. Presenting chief complaints. So here, so many complaints will be there with the patient. So here, important thing is we have to take down the complaints in chronological order. In chronological order. Because chronological order means step first what happened to him. That you have to write. You see, here three things according to patient. Patient said three things. This is example, okay? This is example. Here three things patient said. So we have to take down in chronological order. How you see? This is since 4 months he is not able to concentrate on one task at a time. So this problem was there since 4 months. Irritability since 2 weeks. We should not write this one first and this one second. Because first what happened, since 4 months his concentration, he is not putting his concentration on his work. So this is what first happened. First understand it by patient himself. I couldn't able to, patient used to say, I couldn't able to concentrate. I couldn't able to continue my work. So he's telling. Then irritability he felt since 2 weeks. Last 2 weeks he is getting irritated. If anybody coming to talk with him, he will get irritated. He is getting aggressive that time. If anybody talking, you don't like. If anybody coming to his home, you don't like. If anybody taken his properties, his belongings, you don't like. That is irritability. So this is since 2 weeks. So after 4 months, before 4 months, this was there. Then after 4 months, this 2 weeks problem is there. An inability to sit at one place since 1 week. Inability to sit at one place since 1 week. 1 week he is not able to sit in one place. He is wandering here and there. That is wandering tendency is increasing for him. So he is telling I couldn't able to sit one place. If I sit one place, I will get irritated, so I will go. So there also irritation. So but this is happened since 1 week. So here written first what happened since 4 months this problem. After that 2 weeks irritability. After that 1 week inability to sit at one place. So this is the order. This is the order. This is chronological order we are telling. The next is according to informant. His father also gave information. So what is frequently changing moods? Happy mood, sad mood. Morning he was very happy. Then suddenly he's getting angry. Then he's not. He don't want to talk with anyone. So like that his father is telling. So this problem presents since 7 months. Inability to complete task since 6 months. So after this only it is happening. Complete task. Already patient also felt 4 months he couldn't able to concentrate. Father is telling since 6 months he is couldn't able to do anything regarding any works tasks. So inability to complete task 6 months. After that what happened? Inability to sit at one place. Say 4 months. Patient said 1 week, but they find the problem uh, since 4 months. But patient understand it from 1 week. But this already is doing like that. His father find that problem. Doesn't seem to listen since 3 weeks. 3 weeks he doesn't want to listen anybody. Uh, that one. Excessive talking since 2 weeks. Since 2 weeks he is talking excessively. It means he's shouting or simply talking something unnecessarily, talking something without any goal, talking something. So that type of problem was there. So since 2 weeks. Inability to follow directions since 1 week. Since 1 week he is not able to follow any direction. Direction in the sense his father is telling go and purchase something. He is not listening. You study to uh, for the best future, best of your future. He is not following. So whatever it is, he come early to home. He is not following. So that type of inability to follow directions. So since 1 week, he is telling you study. He is not able to study. So that's what inability to follow directions since 1 week. His irritability since 1 week. So they are finding he is get irritated. That they are finding since 1 week. But the patient himself understood since 2 weeks, but father understood since 1 week he is having this problem. So after shouting since 2 days, he is severely shouting to everybody. So that happened since 2 days. That's why they took the patient to hospital. So this is like this. This is chronological order. First what happened, after that what happened, after that what happened, after that, after that, after that. So last till he get the admission, what happened? The nurses taken these notes. So this is what presenting chief complaints. In this form, we have to take this chief complaints. This is very very important one. Okay, this will next is history of present illness. In present illness, now what is happening? So one is duration. You see, 1 day, 2 weeks, 4 months, or 2 years. So any one we have to write. Maybe problem present 4 months. Then you can write 4 months. Or 2 years. 2 years means anything. If it is 1 year, or you write 1 year. This is the example. So that you have to write duration. History of present illness. Present illness. So how long it is there. And then mode of onset. Mode of onset. How it is started. Is sudden or unexpected. If you see that's abrupt. If you are writing abrupt, it means when you have to write this one, if the signs and symptoms or problems started less than 48 hours, then you can say abrupt. If it is more than 48 hours and less than 1 week, then you can say acute. So when you say acute onset, then it should be less than 1 week. Then subacute 1 to 2 weeks. If 1 to 2 weeks, you can say subacute. Okay. Next, insidious within few weeks. Within few weeks it happened. That is insidious. So he's shouting. This patient is shouting. It has happened within a week. So within a week it happened. 2 days happened. 2 days means uh, 2 days. 2 days, not less than. Okay, three. If it is 2 days, we can approve. Also, we can say otherwise acute. If less than 1 week, we can say acute. If less than 48, abrupt. This less than 48, less than 1 week in the sense more than 48 hours and less than 1 week. That means acute. So anyone which is suitable for that patient, we can write. Not all things we should not write. Anyone which is suitable exactly. That you have to write. Course, course in the sense the how it you see if the disease is continuously, if the 6 months before it started and continuously it is the problem is continuing, it not stopped at any point, it is continuing, then we can write continuous. This disease started here and it is continuing till date, so that time the course is continuous. Episodic, episodic means episodes. Day before yesterday the problem was there, then again today also started, then like that episodes is there, like this, started end, started end, started end, like that. If it is going, then it is episodic. Or we can write fluctuating. Problem is increasing, increasing, decreasing, increasing, decreasing, increasing, decreasing, but not in this. You see, in between he is normal. Episodic, in between he is normal, but fluctuating he is not normal, but the problems are coming down and going up, coming down and going up, but still problem is there. He is not having any chance of in normal being in normal mode. Otherwise deteriorating, it is increasing, deteriorating, it is going to danger level, bad condition. It started just irritation was there, then moved in tendency to move, then high irritability, then violent behavior, aggressiveness, and started to beat everyone and affecting him, affecting the environment. Like that it is going. It's a bad condition. Another one is improving. Improving means that it was bad condition was there, but it is coming to good condition. It means he was getting very angry, and now the anger is reduced. He started to understand the problem, but sometimes he is getting issues. Otherwise, it is normal. Like that, it is reducing. The problem is becoming changing step by step. That time we can say improving. Or unclear, the patient is either improving or increasing. We cannot decide the above things. Whether it is continuing, we cannot decide. Whether it is episodic, we cannot decide. Or fluctuating, we cannot decide. Deterioration, cannot decide. Improving, we cannot decide. So we are not able to decide what is actually the condition of the patient. And that time we can say unclear. That time we can say unclear. So this is about course. Next is intensity, severity of the problem. You see, severity, one is same level. That is, if the pain continues, we are telling you like that here same. Otherwise, it may be increasing like this. The strength of the disease condition, strong. Yeah, that is if it is increasing, then increasing. If it is decreasing, then decreasing. That it means decreasing. It is coming down. This is we are telling intensity. This is severity of the disease. Severity of the disease. If it is increasing, then increasing. If it is decreasing the severity of disease, then decreasing. Or it is in same level, then it is same. That is intensity of the disease. Next is precipitating factors. Precipitating factors means just what is the cause of the onset of disease. Just the causes, the things happened just before the onset of disease. That is called precipitating factors. This is one of the cause. Precipitating factors refer to a specific event or trigger, specific event or triggers. Triggers means anything that stimulated the problem. So triggers to the onset of current problem. To the onset of current problem. One student got some signs and symptoms. She is showing some signs and symptoms after his exam. So what triggered him? Maybe the exam triggered him to become mentally ill. The exam is the cause, then we can say That is the precipitating factor. So here two things are given. One is physical stress. He is continuously 24 hours. This person is working for his company due to some emergency, and he is not able to leave that company also because of his commitment in the family. So what happened? He will work hard. He is doing continuously. The stress is increasing. In certain point, he could not able to tolerate the stress. That time, that it is became a precipitating factor for his mental illness. Suddenly, he broken his computer. He shouted to his boss. He shouted to his family members. So that condition, that time he is mentally ill. That's why he is doing that. Its cause is the precipitating factor is the work, physical stress, psychosocial stress, family problems, problems between boss and worker. So like that, any uh, problems in the society, so that leads to person become mentally ill. That time we are telling it psychosocial stress. Stress, this psychosocial stress. So this is here precipitating factors. These two things, physical stress and psychosocial stress, probably they are precipitating factors of the current uh, onset of the problem. Okay, that means precipitating factors. Onset means started. The current problem started. Then what is the cause of the current problem to start? That is called precipitating factors. That is called precipitating factors. Next, you can see description of present illness. Present illness, chronological description of abnormal behavior. So that I already explained what is chronological order. So in that same way, we have to write his abnormal behavior. Same thing, abnormal behavior is chronological order. We have to write first what happened, second what happened, third what happened. Then other problems, associated problems. Associated problem in the sense these problems is abnormal behavior related other problems like suicidal ideas. His problem is he's shouting, he's roaming here and there. The patient is using bad words towards everyone, and also sometimes he is attempting suicide. So that time suicide we can write or homicides. This thought content, the thought content, it may be hallucination or delusion, maybe delusion. Thought content is delusions. And speech, what about his speech? He's talking over talkative, that and all we have to see. And mood states, maybe hyper or hypo moods will be there. Then abnormal perception, that is hallucination problem will be there. Biological functioning, any biological related issues. Social functioning, that is how he is behaving with others, or whether fighting with them or cooperating with them, other members, family members, society. Occupational, whether he is doing, next is occupational functioning. He is working properly or leaving the job frequently or quarreling with co-workers. That now we have to find and write. Changes in daily living, activity of daily living, daily livings, activity of daily livings, or daily activities. In that any change, which means he is sleeping more, or morning 4 o'clock he is getting up and disturbing everybody. He's not taking bath, he's not brushing, food correctly not taking, or wasting more, taking over and over. So these things we can find and write it here. So these are a description of present illness. So when we write here one example given, so like that we have to write. In sentence if you are writing, that is better. So here one example is there like this sentence. What is his name? How he developed? What are the problem was there? What is medicines he is taking? Like that. Here what are the information? These are the basic information I given. You see in this everything will come. Not only this, you see here duration, onset of mode of onset, course, intensity, precipitating factors, description. This is of present illness. In this description, all this we can include, not the problem. So description of present illness. Okay, separately also we can write or together one paragraph we can mention about this present illness. Next is treatment history. In treatment history, we have to write about drugs, name of drug, dose, route, side effect, nurse's responsibility. These things, if any other things you can add, means add. You can you people can refer 2 to 3 books, and you can find if anything is important points are there. You can add here. Next, one more column you can add. Two more columns you can add, if it is needed. So here, very important is name of the drug, dose, route, side effects, nurse's responsibility. This nurse's responsibility means some drugs when we give, we have to frequently we have to check their blood levels. Means drugs in the blood, other blood levels of drugs. Because if it is increasing the drug level in blood, sometimes the patient may die, or it will be more complication to the patient. Side effects will be more. So to avoid that, because we have to avoid that, we need our some particular responsibilities are there. That drug by drug it may vary, so that we have to write here. Then ECT, this is ECT, electroconvulsive therapy, that we have to assist with the patient, assist with the doctors, and if that we have to write how many times he taken, pending how much is there, and what is after ECT, what is the condition, everything we can write here. Okay. Next is psychotherapy. Psychotherapy. This is patient and nurse. We have to talk together, and the nurse will try to, or doctor will try to take out his problems by discussion, by, yeah, perfect nurse patient relationship, or perfect communication. Through the communication, the nurse or doctor will reduce his problem. He will give solution to his problem. He will understand his uh, current disease condition, his mental status. He will understand. That will be helpful for the treatment. So for this we can use psychotherapy. And next is family therapy with family members. This is nurse, otherwise doctor may place here. So family members, they will discuss, and they will try to solve their problems. So this is family. With family they will do psychotherapy. That is called family psychotherapy. And rehabilitation. You see, after getting treatment, if the patient getting normal, then after treatment he has to go to his society. So society will see him as a psychiatric patient only. So he need to survive in the society. For that he needs some activities that will help him to take care of himself. So here the one type of activity the nurse is giving to this patient. This will help after he released from the hospital. How it will help? What he learned, that he will do in his society, and he may involve in small businesses. That will give some revenue to him, and also help him to survive in the society. Because that is common, psychiatric patients are neglected by the society, because they they were getting fear whether this patient uh, may make problems in their context. So that's why that's why the medical people's helping the patient to learn something, to survive in the society independently. So this is what um, rehabilitation. And next is treatment history over. And next is past psychiatric and medical history. Here, if there is no past history of any psychiatric and medical history, we can write no significant data found related to psychiatric illness in past life or medical in past life. Like that we can write. But if it is there, then we have to number of previous episodes, how many times it happened, psychiatric problem or medical problems, how many times hospitalized in psychiatrist, the with onset and course. Already we studied what is onset, what is course. If you are again, if you get doubt, you uh, go back in this video and understand what is onset and what is course. So that things also we have to mention if there was any history of psychiatric problems or medical problems. Then complete or incomplete remission. It means before that 2 years back the person had psychiatric problem, but after that it remitted. Whether it is completely or incompletely, that's what. Completely remitted, then again now it started. Otherwise, problems reduced only he will get sometimes irritated. Um, like that, if there is any statement that is called incomplete remission. Remission means he became normal after the problem. So that is remission. It means 2 years back or 3 years back he had a problem. After that he became normal. Then that is called remission. But if completely after that became normal, then it is complete remission. But he had 5 or 6 symptoms of psychiatric problem. But at the end of the uh, his treatment, he became normal. But sometimes he will get irritated. If the person is telling like that, then you can understand that is incomplete remission. Every time some others will tell he used to take drug weekly once. Otherwise, any problems comes, he will take drug. Then he is not. But now drug also not effective. So these are type of sentences if you are getting from the patient side, then it means incomplete remission because he used to take tablets, but problems persist. Okay, so that's the difference that we have to write here. Duration of each episode that you have to write. Duration already we saw. Treatment details and its side effects if any. Treatment details and its side effects if any. So what treatment he had and what was the side effect he was experiencing or he experienced, that you have to mention here. And treatment outcome. So in complete and a good treatment outcome in this case. So treatment outcome, what is the outcome? That we have to write. Or incomplete means what was the outcome? Incomplete means usually the patient was angry in some situation. But if you take medicine, then he is not getting any problem. So like that. Otherwise, complete remission time, treatment outcome was very good. The patient completely all right. Yeah, after that till now he didn't show any signs and symptoms. But yesterday only some problems happened. That's why we came to hospital. So like that, the patients may say, our patients' relatives may say. If they say that and all, we have to write treatment outcome. Details of any precipitating factors if present. Details of any precipitating factors I already said. If so after marriage one person become mad. So his precipitating factor is maybe the family quarrels or family quarrels between the husband and wife. So that will be the precipitating factors. Okay. So like that we have to find. What is the cause of current uh, onset, onset of the problem? Problem. Substance use details. If he is alcoholic or cigarette or any drugs, if he is taking, then we have to write here. The surgical procedure, accident, these are related to the medicals that we have to, if available, then we have to mention here. So this is the problem there. We have to. This is paragraph wise also we can mention, or point wise also we can mention. Okay. Then family history. Family history. One is table we have to mention. Another one is tree. And that is this is genogram or family tree we used to say. These two we have to mention. You see family tree, name of the family members, relation with the patient, age, sex, educational status, occupation, health status, age and mode of death. So at the which age they died and mode of death also we have to write, because if any psychiatric problems was there is the cause of psychiatric problem was the cause of death, then we can understand. So this is hereditary problems. So that will helpful for that. That's the family history you have to write. You see, in genogram, some more explanation you will get. That means here three generations, here one, two, three is there. One is, you see, this person had the problem. Here, everything is example. This is example, not about any particular patient. This is example I mentioned. Here, one example patient is there. Then Mahima, 19 years, studying UG, UG studied. So he is having problems. She is Mahima, so female. She is having problem schizophrenia. This is female. If round is there, female. Square is there, male. Here no need to mention female or male because we understand. It is understandable. This is female. This is male. And the line is there means died. They are no more. And this is consanguineous marriage in family relation. Married in the family. Uh, so that's like two lines are there. Otherwise, one line is enough. Husband wife. This is also husband wife, but family marriage. That's why here given two lines. So these are all symbols to understand. So this is female Mahima 90 years. She had problem. So she is having elder sister, younger brother. Okay. So their father, mother here, father, mother. Okay. Then father, mother. Then his parents are here, parents, and he is having one younger sister, younger sister. And here patient's mother, mother family. Here to his younger brother and their parents are here. They married, their marriage was consanguineous marriage. Father died, mother alive. She is having diabetic problem. 52 years old, illiterate. She is taking care of agriculture. His field, agriculture work she is doing. And here they died. She is no more. And his grandfather is there. My father's maternal, paternal grandfather. Okay, so these are the things. This shows the entire family details. If anybody here, if anybody having any psychiatric problems, we have to mention that will shows the cause of this lady's problem. So like this we have to mention. This is family tree or genogram. Usually three generation we can mention. And sometimes like this also. Patient's father, mother, family. So there three generations coming. One, two, three. His first, this is last generation. Before that, this generation. Before that, this. So one, two, three. Three generations we are mentioning here. Your father's family also mentioning. Mother's family also mentioning. Okay, this is very important. This is family tree. Next is personal history. Personal history. 10 things we have to take. This is vary according to the patient age. If you are taking care of children, or taking the history of children, then only childhood, perinatal history, childhood history, and educational history, play history, we can take. If it is adolescence, then we can take from this to this, we can take perinatal history or childhood, education, play, and adolescence, and puberty also. For adolescence, also puberty we can write. Then obstetrical history also we can write. Obstetrical history, if it is, you see, obstetrical history, if the patient's obstetrical history, but this perinatal history, patient's birth time, what happened? That's the difference between these two. This perinatal history, birth time, what happened to patient? It means patient was child, mother is giving delivery or pregnancy. That time, what are things happened? That we have to write in perinatal history. But this obstetrical history, in patient's obstetric condition, we have to write. Patient obstetric condition. This is patient's mother may be pregnant. They are giving the delivery of this patient that time. Okay, detail we can see. That different we have to understand. Perinatal history and obstetrical history. In occupational history, this is job related history. Sexual and marital history, this is not for children. And occupational history also not for children. So no need to write. No need to mention this heading also. But if it is working people, then occupational history, and we can write. If female, we can write obstetrical history. But if it is adult male, we no need to write obstetrical history. Like sexual and marital history, if married, then we can write sexual and marital history. If not married, no need to sexual and marital history mention. Then premorbid personality, also we can do that. I will explain now. First, perinatal history. Perinatal history, antenatal period, maternal infection, exposure to radiation, any other checkups, any complications happened during that time. That usually we will get from the parents. If anybody taken the patient to hospital other than the parents, it is not able to get exactly what happened during antenatal period. But if parents, we can get antenatal period time what happened. So if you are thinking mother taken a patient to his son, his son is the patient. You taken to hospital, then the nurse can ask to his mother about maternal infection, exposure to radiation, or any other checkups, any complications happened or not. That we can ask to his mother. So mother will say there is a chances. And intranatal period, this also that is antenatal period. Then intranatal period, that during time of delivery, at the time of delivery. Antenatal period at the time of pregnancy. So intranatal period, delivery time, what happened? If it is normal, then normal. Instrumental delivery happened or not, that we have to ask. Cesarean or any complications was happened, we have to write. This is here also any complication at the time of antenatal period. Here any complication at the time of intranatal period. So birth, full term, preterm, post mature. So in this, what is suitable that we have to write. Not all these things. Which is suitable we have to write. Here so many options are given. Which is suitable that you have to write. And birth cry, he cried or not, or delayed cry, that you have to write. Birth defects, if anything find that time, that we have to mention here. Postnatal complications after delivery, what happened to the baby, that you have cyanosis, conversion, jaundice, neonatal infection, any other. So you see this perinatal history full and full, it is telling about the patient's condition at the time of uh, when he is inside his mother's womb, and during delivery and after delivery. Okay, that here we are talking about the patient only, not about mother. Whatever happened to mother, it affect. There's a chance of chance. There's a chance of getting problems to the child. So to know about child, we are asking about mother. Okay, we are asking to the mother. Okay, this is regarding patient only. So next is childhood history. Childhood history, when the patient is child. So who was the primary caregiver, that you have to mention here. Okay, most of the time mother is the primary caregiver. Some peoples will get is auntie or workers. So like that will be there. So who was given the main care? Who is the primary caregiver at that time? That you have to write here. Then about feeding, breastfeed important thing, because children are getting nutrition at that first nutrition from the breastfeed only, breast milk only. So that we need to assess whether they're given or not. Because if not given, there might be infection on the brain that time. So that is the cause of current problem. Maybe the cause of current problem. So that's why we have to write breastfeed. About breastfeed, we have to ask artificial mode of feeding given or not, or what they have given, that we have to ask. Age at, so weaning when they started. Usually after 6 weeks. After 6 weeks they will start weaning. So that we can write. Developmental milestone. It means uh, each month, each year, some developmental uh, things are there. It means one they getting up in particular age, and they will start to walk at particular month. They will started to speak in particular months. This and all happened or delayed. That things we have to write. Some children will talk after 3 years. So that problems we have to understand. Then behavior and emotional thumb sucking. Here you see thumb sucking. If excessively thumb sucking uh, after becoming toddler, uh, child, that time also they are doing thumb sucking, then it may be oh, shows the causes of mental illness. Not all children, sometimes it may show. So thumb sucking, about thumb sucking we have to ask excessive temper tantrum like this, aggressive behaviors the child will show, excessive they will cry till they get what they asked, uh, means till they get the uh, things what they want, they will cry. So that is excessive temper tantrum. Okay. Then stuttering, speaking issue, stuttering. Here you see this picture showing stuttering. My actually his name is her name is Maya, but when he asked her name, she is trying to say Maya, but couldn't able to complete. Maya, like that she is telling. So this thing is called stuttering. And head banging means like this. You see, they will hit head toward against the walls, bed, pillow. Okay, whenever they get irritated, they will hit their head. So that is we are telling head banging. Body rocking. It's like that they will move their body continuously to avoid the unpleasant situation. They body rocking. Nail biting, you know. Paika, Paika eating mud. This baby, you see, this baby eating mud. So this is called Paika. Matlab, uneatable substance if they are taking, then it is called Paika. Usually children will do. Then enuresis, bedwetting. Here you see, bedwetting. This is urine passed by this child, bedwetting. Morbid fear. This is fear. Unnecessary fears will be there. Night terrors. Night terrors means sleeping time they will get uh, dreams, fearful dreams. Suddenly they will wake up, they will cry. That is continuously happening means that is called night terrors. Somnambulism, walking, sleepwalking. You see, sleepwalking is going. Somnambulism, sleepwalking. Okay. And illness during childhood, specifically for central nervous system infection. If anything happened or not, that we have to mention. Then epilepsy, here epilepsy, fits type of things. Okay. Convulsion, epilepsy. If there, we have to mention. Neurotic disorder, any other neurotic disorders like anxiety, phobia, obsessive compulsive disorder, anything is there, we have to take down. Malnutrition, it's about nutrition. Protein energy malnutritions are there, that we can write here if there. So this is about childhood history. This is about childhood history. Then educational history, age at beginning of formal education, academic performance, extracurricular activities, achievements. It may including the games, singing, dancing, like that. Relationship with peers and teachers. Okay. Some students always quarrel with teachers and they will make quarrel with peers. They will not talk with the co-students. Okay. School phobia, yes or no. Look for conduct disorder. For example, truancy and stealing. Truancy means good child. Stealing means bad child. Bad characters will be there. They will take others' properties. They will hit others. So many things will be. That is stealing. Truancy is true child. He will not take anybody's properties. He will talk with everyone. So like the good fellow. That is yes or no we have to write, mention, and otherwise we can mention truancy was there. Reason for termination of studies. Reason for termination of study. If terminated. If not terminated, no need to mention. But if terminated, we have to mention. Okay, terminated. Next is play history. Games played at what stage and with whom. Relationship with playmates, how they are maintaining their relation with playmates, always quarreling or making good friendship with them. This and all will be helpful to understand their uh, problems. Then emotional problems. This is running away from home. This is mostly adolescent problems. Running away from home. Suddenly one day they will leave the home. They will not tell to parents. They will go somewhere. That may happen. And delinquency, doing mistakes and childhood time like this, hitting others, stealing, here using guns. Okay, the childhood uh, mistakes, crimes, that is called delinquency. Then smoking, then drug taking. So these are some emotional problems during adolescence. In that, what is there that we have to mention? If not there, no need to mention. And puberty, here two things we can see: puberty and sexual and marital history. Puberty, age at appearance of secondary sexual characteristics. Secondary sexual characteristics when it started age, anxiety related to puberty changes. The secondary sexual characteristics means uh, the appearance of mustaches and pubic hairs, and there is changes in the chest for females, and the structures for female changes in structure of females, sound changes for boys especially. So these are the secondary sexual characteristics. So anxiety related that how when it started, that we have to write. Anxiety related to puberty changes. If there are any anxiety related to puberties, that mostly happen to females, that we have to write. Age at menarche. Age at menarche, that we have to write. We at what age? Then reaction to menarche. Regularity of cycles, duration of flow, abnormalities if any is there, dysmenorrhea, menorrhea, anything is there, we have to mention here. This is if it is female patient, we can write. Otherwise, no need to write this. The first point we can write. This age at appearance secondary sexual characteristics, we can write. Okay, anxiety related to puberty also I think we can write. These four no need to write for males. Females everything we can write. Okay. And sexual and marital history, genogram, family tree is there, no? So details of spouse and children is related to that. Type of marriage, self-choice or arranged. Duration of marriage means how many months or how many days, how many years over after marriage. That is duration of marriage. Interpersonal and sexual relations. These are married people only we are taking, not for children and adolescents. Okay. Interpersonal and sexual relationship, satisfaction and unsatisfactory. Extramarital relationship if any specified. That also if there we have to mention. So this is about next premorbid personality. Premorbid personality, it is interpersonal relationship, extrovert, introvert. You see extrovert, introvert. Introvert means these people always used to study. They will not talk with anyone. They will not participate in any entertainment activities. But extrovert people, the open-minded people, always they will enjoy with others. They will roam here and there. They will not sit inside home always. They have more friends. So these type of things, that is a different. It's a introvert, extrovert that we have to understand. Family and social relationship, how they are meeting. Use of leisure time what they are doing, that we have to write. Predominant, which is predominant mood, that we have to write. An optimistic, pessimistic. Here the optimistic, pessimistic. So this is pessimistic. Fear, this is true. Fears, thinks this is the best possible word. So like this, they will understand. Optimistic people, they easily adopt, but pessimistic people, they will not adapt easily. So we have to understand whether they are optimistic or pessimistic. They are always sad, they are always happy. Stable, fluctuating, stable mind means these people is mostly stable minded. These people sometimes fluctuating mind there. Fluctuating mind in the sense they're happy, sad, they will study, then again they will not study. They will think this is good, then after they will think this is bad. Stable mind people say, okay, tomorrow I have to study, so I have to face all things. Then they will study. Whatever problems comes, they will face. That is stable and fluctuating, and cheerful and despondent. So same like that. So next is usual reaction to stressful events. Stressful events, what is their reaction? Some people will cry continuously. Some people immediately they will come to action. They will talk with everyone. They will try to solve the issues. Then attitude to self and others, how it is there. Then attitude work and responsibility, religious beliefs and moral attitudes, fantasy life, daydreams, always in daydreams. Okay, so frequency and content, continuous frequency, per day how many times they will be in daydreams, and what they are dreaming, that is content of daydream. They are dreaming about their marriage or any sexual activities or education or anything like that. That is fantasy. And habits, eating pattern, elimination, sleep, use of drugs, tobacco, this and that we have to mention. This comes with habit. So these things is called pre-morbid personality. So after this, so this much it shows the personal history. This is about personal history. These are 10 things we have to write, but not for all peoples. These 10 things which is suitable to children, that we have to ask to student. And old age, adolescents, females, pregnant mothers, also like this. We, in each different stages of life, uh, there is suitable things are available. Based on that, we have to ask the questions and write these things. Okay, next is personal history over. So thank you. I hope you understood.